Hello Melissa, and thank you for joining me today. And we're going to look in particular at areas of tension in your neck and shoulder area here that you've been complaining about. So what we're going to do is identify those areas and actually mark them out, and then we are going to work on those areas once we've identified them. So first of all, what I'd like to do is just pop your hair out of the way so it doesn't get tugged on. Okay. And are you comfortable on the pillow? Yeah. There. Thank you. So what I'd like to do first is just cleanse your back, and then I'm going to check for contraindications. So looking for anything that might prevent me doing a treatment on you today. So first of all, what I'm going to do is just cleanse the area with a lavender floral water hydrolate. And this is the water that's left behind after the aromatherapy essential oil has been taken out, and it's actually very cooling and cleansing on the skin. So it's going to remove anything that's left on the skin. Just going to do the back of the neck there as well. Okay. And then what I'm going to do is use the magnifying glass just to check for any contraindications. So I'm looking for any bruising, any broken skin, or anything that will prevent me from doing a treatment on you today. So I'm going to start at the neck area here. And actually, when you're doing just the neck and top of the shoulders here, as we're doing today, having you on a pillow like this is very useful because it makes this area show up much more easily, and you can get quite close to the area to check for any of these contraindications. And I'm just running my fingers down, so if anything feels tender at the moment, I'm not pressing too hard, but it can show if there's any bruises or anything like that. So do let me know if there is anything that feels tender at all. Okay, so just look at the bottom of the neck area there. There's a couple of blemishes, but they're not open. Nothing feels rough or tender. And I've had no reactions from you, so I think we're all good to go. Okay, so what I'd like to do now is use my wonderful colourful pens to try and identify any areas that are particularly tender, and we'll mark those out with these pens, and then we will go back afterwards once we've identified these areas and go in and do some pressure massage in those areas. So I'm just going to start with one of these pens and have these ready to identify. So what I'm going to do first is just some light pushing on the area of your left shoulder area here, and do tell me if anything feels sensitive at all. Everything okay on the left side there? Okay. Right, I'm just going to work gently in this neck area. Nothing there at all?
It feels a little bit tense.
Okay, any particular area? If I run my finger down there.
Yeah, more here.
Here, top of the shoulder area. Okay, so that's one area of sensitivity that we've identified. I'm now going to move over to the right side. So I'm just going to do what I did on the left side, but do tell me if there's any soreness or tenderness.
Yeah, a bit there.
Yeah, I can feel that. It's quite... Oh, this is all quite tender here. Still okay?
Mm.
Anything here at all?
Yeah.
Okay. What about lower down here?
Yeah, it feels different though. It's a different kind of tension.
Right, okay. I'm getting a little bit of a pattern here actually. And it's tailing off. I'm going to go back to the top bit in a minute, but let me just finish this bit off here. Right, that's okay. I'm just going to go up to here again.
Yeah, that's so much more tense though.
Right, okay. That makes a lot more sense. So that makes more sense. We're going to... a definite pattern here. Okay, I'm just going to go a little bit higher into this area. Right in there. Is that sore at all there?
Yeah, it is.
Right. And that is actually the same as on the other side. Yeah, feel that tenderness. Okay. Right, I'm just going to go a little bit higher into the neck area. You feel anything on either side there at all?
My whole neck just feels really...
Just the whole area feels tender. Yeah, it's really tight in there. Pinks. Sorry, I'm just going to choose a different colour because that pink's not coming out. So what we'll do is put that along there. And that area on the left at all?
Yeah.
There is a definite pattern here. And to me that says either the way that you're sitting at your desk maybe, and you're typing a lot. It could be that you're not sitting properly and that's really impacting this area on your right shoulder, and again into your neck area. It could be where you're leaning down to look at the screen possibly, but it does smacks of PC usage, I think, and sitting at a desk incorrectly. So maybe that is something you've got to think about and really look carefully at how you're sitting. And I can ease this today definitely for you, and we'll massage that out and do a little bit of pressure point moves on there. But I think going forward, that's something that you really have got to think about in terms of your positioning. So what I'm going to do is really do some pressure point moves on these areas just to ease some of the tension out of there. Can feel that slightly relieving that stress in that area. So we'll keep going with the pressure point moves, and then we'll do a little bit of an overall massage. Please tell me if this feels too painful. This is sometimes, you know, when your neck's really stiff and you almost want to do that yourself and you push in the areas that are giving you discomfort. This is a very similar process to that, but you've obviously got somebody putting a little bit more pressure on it, which will help to relieve it that much quicker. But stressing this area can really be quite distracting and painful. So I'm going to do the same in this shoulder dip here. Oh, sorry, I'll ease off. I can feel you reacting to that. Okay, just do it, not quite so much pressure. We've got this one over here. We'll do similar, but not press quite so hard. Looks like the top of your shoulders are really tense. So I don't know if you've been maybe carrying things as well, but this is often a point that some of my clients have when they carry heavy handbags on their shoulders. It could be that that's related to that as well. Have you been carrying lots of things recently?
Yeah, my handbag.
Oh, okay. Right, and then that probably explains the stiffness here as well. I'm going to do some very gentle moves on there, and that will just help to loosen up that area a bit. It is tense, but I think it's tense because it's coming from the pain that you've got lower down. That's it, it's loosening up now. You don't want to push very hard on this area, it's very sensitive. Okay. Right, what I'm going to do is just cleanse off the residue of the colour. Yeah, I've got a little bit of erythema going on here as well, which is fine. It just means it's clearing that area. Just going to put some of that hydrolate on again just to clear that. Okay, now we've got the skin nicely cleaned, what I'm going to do is just to help finish off with a gentle massage to soothe the area, because I've been punishing it a little bit, is to add some grapeseed oil just into this area so that I can just massage it slightly. So we'll just effleurage over those areas that we worked. Some very gentle moves either side of the spine there. That's much better. You can feel the tensions released in that area. And just to finish off, can we do some deep breathing? So just 3 breaths. 1, 2, 3. Okay, and hopefully that will really help that shoulder area that's been giving you some problems, and should really feel the tension eased out of there. So thank you for allowing me to demonstrate how to get rid of stress that is obviously caused by something, and we need to perhaps work that out, but it's been useful to demonstrate how easy it is to spot this, and this was a definite pattern, and do something as simple as acupressure points and a little bit of massage, and that's really helped to relieve that situation. To start by inspecting your back first. We're going to be working on acupressure points today, but first I need to check the condition of your back. Give it a good inspection, and then I will clean the back area, and then I'll move on to looking at where those acupressure points are that are related to back and shoulder pain in particular. So I'm just going to inspect the back first, looking for any contraindications. Particularly in the areas that we're going to be working. I can't see anything untoward at the moment, but what I'd like to do is examine it a little bit more closely with a magnifying glass. Right, I'll start over on this side. few natural bumps, just checking that they're not open or anything like that. That's the back checked. I'm just going to check around the shoulder area now. That's all okay. Just a couple of bumps, but nothing to worry about at all. Okay, so what I'm going to do now is I'm going to cleanse the back. This is just straightforward cleansing lotion, just to get rid of any impurities that are on the surface of the skin. Okay, and then just to make doubly sure, we're going to tone it as well. Apologies if this is a bit cold. That gets rid of any surplus cleanser that's left. So what we're going to do now is locate some of those acupressure points so that we can help to relieve some of your back pain and shoulder pain. So just to talk to you a little bit about acupressure, which is a traditional Chinese medicine technique. And it's based on the principle of qi, which you may have heard of before, or the energy flow through the body, often using something called the meridians. There are 14 meridians in all connected and interlinked. And the acupressure points, of which there are 361, are all located along these meridian lines. Some of them are obvious. Okay, the first meridian is the lung. Then you've got the large intestine, the stomach, the spleen, the heart, the small intestine, the bladder, the kidney, the pericardium, the triple warmer, the gallbladder, the liver, the conception vessel and the governing visual. Most acupressure points are located in what we call small depressions or hollows in the body, which are between bones or muscles or tendons. And you do have to be a little bit careful about the pressure that you use, particularly if you're still getting used to pressure points. Maybe start with a light pressure, just the tip of your finger, and then once you feel more confident, you can start going in and pushing that much harder. Okay, so what I'm going to do is locate some of these pressure points, known as acupoints, and you can use these yourself to press in. Obviously it's nice if you've got somebody that can do it for you, but do be a little bit cautious. There are certain people who need to just be a bit wary. People who are pregnant, for example, can overstimulate certain areas, and obviously if you've got medical conditions, then just be wary that there are certain pressure points that you shouldn't push, which can stimulate certain areas. So just a word of caution, but generally using acupressure points can really help with your overall sense of well-being. So what I'm going to touch on are pressure points which people often ask about, and that is areas such as the neck here, the shoulders, and in particular the back and the lower back in particular. And there are a number of pressure points which you can press on yourself to help with relieving aches and pains once you're a little bit practiced and confident. If not, then obviously try and see a massage therapist that is familiar with acupressure points. So one of the first ones that I'm going to look at is something called GB21, which is roughly in the middle between the neck and the shoulder. Now GB21, the GB stands for gallbladder, and 21 is its number on its acupoint along that meridian line of the gallbladder. And it's in that sort of soft hollow of the shoulder here, slightly more on the top. And I will draw that a little bit later once I've got an idea of where all these points are on your back. The benefits of GB21 are pain relief in the neck and the shoulder area. So you have GB21, you have another set which is GB20, which is here and here, just in the crease of the neck. There's a slight dip and hollow at the base of the skull, at the back of the head. And we'll mark those out a little bit later. And that in particular helps with neck and shoulder pain and upper back pain as well, and can really help with headaches. So useful to know where that actually is. I'm going to draw GB21 now, so it's very clear. So we've got a thin side on the pen and a thicker side. I think I'll choose the slightly thicker side. So it's in between the top of the shoulder blade and the base of the neck, in the middle area. Right, and on this side as well, I am drawing it slightly bigger than it is, just so that you can see it. And when we come to push that, we'll just do sort of in the middle of it, but it just gives you an idea. So that's perfect, right in the middle between the base of the neck and there. So that's GB21. So let's choose a different colour for GB20. I'm just going to pop your hair up a bit more. And there's a little hollow either side. It's probably more to the top of this. That's great. And then one of the other ones, if I can pop your arm up slightly. Now in the crease of your elbow on the inside, we'll do it this side so that you can see it clearly. And this would be on both sides. So right in the crease. And this is known as LI11. And the LI stands for the large intestine. So in the crease of the elbow. And this really helps to relieve arm and shoulder aches and tension. So you would do that there, and you would do that on the other side as well. So it gives you an idea of where that would be. And then that's mostly the top area on the shoulder and the neck that I mentioned. So what we're going to do now is we're going to move down to pain in the lower back. People sit a lot these days, particularly in sedentary types of jobs where they're sitting in chairs a lot, or even people who have standing jobs. A lot of pressure is put on that lower back area. We've also got a large number of people who are working from home, and many people who are working from home can sometimes go quite a long time without realising that they haven't taken a break, and then they try to stand up and their backs, particularly the lower back area, can be very tender, and that is really detrimental to your overall well-being. There's nothing worse than lower back pain, and acupressure in this area can really help to relieve the pain. And I'm going to talk about two particular sets of acupressure points that can really help you here. Okay, so I'm just going to point with my stick again here, just so that I can talk about it while we're looking at where it actually is. So the first one that is really concerned with back pain is something called B23. Now the B stands for the bladder meridian, and 23 is the number of the acupoint or the acupressure point that we're talking about. And it is, if you can imagine a line along your waist here, B23 is in this lower back area, and if you think you've got your spine here, and it's 2 fingers width either side of the spine, but in line with your waist level. So here, for example, it would be here, the spine's here, so it would be here and here. And the benefits of B23 is you can use that to really relieve pain and any weakness you've got in your lower back area there. And sometimes you almost do this instinctively when you stand up and you put your hands on the back of your lower back there to try and relieve the aches and pains. You sort of instinctively go to this area, and that's because that is a key acupressure point and your body's crying out for it to be relieved. So what we're going to do is just draw on that, choose the thicker end of that. So as I said, the spine, if you imagine the waist and the spine, so let's do one at a time. I'll just pop a dot there and I'll enlarge it shortly. Then you've got this side of the spine as well, and you do that here. And then I'll just make that slightly larger so that we know exactly where this one is. And when I come to do the pressure on it, I'll obviously aim for the middle. I'm just enlarging it just to show you roughly where they are. But you may well have done, if you've got that type of job, you may have well done this instinctively yourself. So that is B23. And I've got another set. So this is B47, and it's quite easy to locate because it's 2 fingers away from B23. So roughly here and here on the other side. So we'll get a different colour pen just to highlight that. So again, roughly 2 fingers from the middle of that and 2 fingers from here. So they treat slightly different pressure points. So it's worth knowing that you've got 2 sets there. Okay, so that helps to really cover those areas along that waistline. Then we've got the last 2 that I'm going to cover, which are B25. Now B25 is located 2 fingers width from either side of the spine, but at the hip level, so down from the waist. So where you've got this B23, if you go down from there and you'll see the hip. So it's, if you do these 2 first, they're quite easy to locate. And again, these are ones that you sometimes instinctively push on when you've got back pain when you sit up. From there, coming in from the hips, you can just draw them underneath. And these are the main ones that I would suggest for back pain and shoulder pain. There are a number of others. These are not the only ones associated with that. For example, there's the lung 14, and then there are a couple that are based in the ankle area, which really follow that meridian line and really help to combat pain. There's also one, believe it or not, just under the nose area, which if you push can really help with back pain as well. But it's quite difficult to display those, but I think we've got enough to be getting on with here. These would certainly help you to think about and relieve some of that back pain you've got. Okay, so now we've done that, what I'd like to do is actually start pushing on some of these pressure points so that you get the benefits of us locating them. So I'm going to start with the one on the shoulder area here, which is GB21, and I'm going to push in and hold roughly for around 30 seconds is probably enough, so you can count while we're doing it. So we're going to push on this other side of GB21, which is in that little hollow area, and you can push down just gently to start with, and then if you can take a little bit more pressure, obviously you can add in some pressure. Okay, and then on the base of the head you can do both at the same time and press in. And you can do this yourself as well. Once you are confident and you know where the hollow is that you're aiming for, you can do this yourself and bring some relief to that area, particularly if you've been doing lots of work that's meant your neck is hanging down, then that should make a difference there. Okay, so here we go on B23, just press in there, and obviously that should relieve some of the back pain in that area. And then once you've done that, you would move along to B47. And then once you've done that for about 30 seconds, obviously I'm not doing it for 30 seconds now, but you can do that for as long as it's comfortable. And then that last one, B25, should really help relieve some pain in there. Welcome to what is going to be a wonderful back massage treatment. But first of all, I just want to get the atmosphere in the room suitable for this treatment. So I'm just going to start with putting on the candle that is in this wonderful diffuser. And this is one of the products that has been sent to me by Absolute Aromas, and I love the aesthetics of the diffuser that they've given me here. And what I'm going to do is pop in a drop of a pre-blended oil that they have provided for me called Relaxation. And we're actually going to use this a little bit later and mix it with a carrier oil so that we get that whole sense of relaxation overall. The other thing that Absolute Aromas have sent to me is this Relaxation Natural Room Spray, which I thought we could have a go at spraying on the blanket. just to give it a little bit over here, just to add to the essence of that relaxation element. And it's a very soothing, natural room fragrance with pure lavender essential oil in it. And it helps to create that calming and balancing environment that we're trying to create within the room to give a calming and balanced treatment. So I keep mentioning absolute aromas, and you're probably wondering why. And I've spent quite a long time trying to find products that are at the quality that I want to use in my treatments. And one of my friends recommended Absolute Aromas to me, and I reached out to them, and they have sent me a number of products to try and see if I like them and want to use them for my treatments. And the relaxation spray, the room spray, I really do like. Really has a natural fragrance to it and really helps to calm and create a really genuinely nice, relaxing atmosphere. And again, with the diffuser, they have supplied some pre-blended oils that you can actually use in the diffuser. And this oil called Relaxation actually doubles up as the oil that I'm going to use in the massage. And it comes in a wonderful pack with some really helpful suggestions as to how you can use their blend. So that's an added bonus in terms of the helpfulness and the thought that goes into some of their products. And it includes a little bit about the quality of their oils, precautions, how to store them, and this lovely list of suggestions to use this blend in particular. Now, because I'm going to use this blend for massage, I need to choose a carrier oil for the blend. So what I'm going to do is use sweet almond oil, and I'm going to use their direction in terms of measurements. So you would start with 10 millilitres of carrier oil. And then with their direction is a blend of 5 drops from this relaxation blend. Okay. This is a blend of essential oils that are geared towards relaxation, and it means you haven't got to really think about mixing the blend yourself. And I really like the ones that they've got in here, and this really comes through in the mixture. And then I'll let Melissa smell this, and then I don't know if you can smell that at all.
Oh, that's lovely.
And what they've got in here is a mixture of tangerine, bergamot, lavender, petitgrain, meishang, and ylang ylang, which we have used some of these in the past, but it just works really well with that flavour of what we're trying to do today, which is all about relaxation and balance for this particular treatment. So now we've set the scene for the treatment, what I'm going to do is just check Melissa's back to see if there are any contraindications on the back at all, and just go down here and just check around the back area to see if there are any skin eruptions or breaks in the skin that would cause an issue with the treatment. just on the back of the arms there as well. There's a little spot there, but it's not broken, so it's fine. Okay, I think we're okay there. And then I think what we'll do is we'll make a start with this, and we'll do a back massage and slightly into the base of the neck and the top of the arms, and there should be just enough in this amount to cover that. So we'll start with putting some oil on that. Some nice gentle moves just to get that oil on. Lovely smell, lovely aroma to this. So I'm just going to press in a little bit deeper just to see if I can spot any areas of tension down the back. So we've got a little bit of popping going on around the shoulder area there. And a little bit of popping in the sacrum area there. Yep, here we go. So around the shoulder blades here. We'll work through that. That's just where the muscle has tensed up through use, or sometimes when you're sitting incorrectly, or it could be just a build-up of lactic acid, and a massage will just ease those areas out. Really help with the relaxation. A little bit of dryness on the top of the arms there, so put a little bit of oil on that. That's better. Alright, just going to do some little petrissage moves in the spaces that you've got here. A little bit of redness where the blood vessels are working hard, which is good. That's a good sign. Okay, I'm just going to do that again, get rid of some of this tension here. There we go. And then we'll get rid of the rest when we do around the shoulders. seem to be very focused around the shoulder areas and the sacrum. The rest of your back seems to be quite happy. And also I can tell there's a little bit of tension in your sacrum, because occasionally what you pick up is slight heat under the skin, and I can feel around the bottom of your sacrum there's quite a bit of heat. It could be that you've been maybe sitting at a desk for a while. There we go, it's quite warm there. So we'll know to do a little bit around that later. Just do some effleurage because we've done some petrissage. Just calm everything back down. Okay, I'm going to move to the side now and just do some friction moves around the back area. And we know that there's two areas that we really want to focus on here. So we're going to start with this first area, which is the sacrum, and then we'll work towards the shoulders here. So what I think I will do is do some slightly deeper moves here. And this should really help with this area, which again, lots of popping going on, but also some heat. So it just needs a little bit of love and attention. And you'll find that will really help. How's that tension feeling, all that pressure? Good. I'm going to do a little bit around this neck area first and then. Okay. Then, as I said, I'm going to work around the shoulder areas. If you could just pop that, just so that I can get your scapula popping up, so that I can see that there. That's lovely, thank you. Just going to do a little bit of massage into here where there's lots of popping going on. Get rid of that. That should really help you. Right, pop that hand under better. And if you can do the same on the other side that you did before, that's it, lovely. I'm just going to do that from this angle. That's getting rid of all of that stress and tension in that area. Right, you can pop your arm back again. Get your hands nice and warm again. Okay. And I'm just going to make sure the rest of the shoulder area is massaged out. That should really help with any sort of pain relief around these muscle areas, particularly your shoulders and sacrum. So focusing on those should really help with this, as well as improving your circulation. That increase in blood flow should really help with that area that you've got there. That's quite tense. I think those aromas are lovely. You can actually smell the distinctive essential oils in that blend. Right, we will just finish with some breathing exercises. Okay. Right, I'd like you to do 3 deep breaths with me. 1, in, out, and again, out, and again, out. Hello, Melissa. Thank you for joining me today. Today we are going to work on what will essentially be a back massage, but we're going to really focus on areas of tension. As a part of our consultation, we've identified that you are really suffering with tension areas around the back area and particularly around the neck and shoulder area. So what I'd like to do is just put an added dimension into this to really help us focus on those areas. I really need to identify where they are. So what I'm going to do is mark those areas using some highlighters, and that will really allow me to focus on the areas that need working. And once we've identified those, I can really focus on those as part of an adapted massage, really adapted for your needs at the moment. So one of the things I'm really looking for in the initial stages of this massage is areas that feel tense along the back here, and in particular along the shoulders. And when you try and identify where these are, you will find that they feel like crystals. So first of all, what I'm going to do is just give the back a little bit of an inspection. So visually now, and then I'm going to use the magnifying glass just to check to see if I can see any contraindications, particularly as you've mentioned, you've got a lot of tension at the moment. So I just want to see if there's anything else that might be causing that I can visually see. And once I've done this, I will just, as I said, use the magnifying glass. So I'm going to get that now. And I'm just going to start at the neck area here and just check, particularly around this area. And what I'm looking for here are potentially any areas of bruising that could explain particular pain in this area, or any marks on the skin that could be causing any sort of pain. I can't see anything obvious at the moment. There's a slight red marking, erythema here, but that could simply be from washing or drying. Slight scratch mark there, but that's can simply be where you've removed clothes or something like that. Maybe caught with your nail, but it's not open and it's not really red. Just going to go up slightly into the hairline as well. No, that's all absolutely fine. So what I'm going to move on to do is look at diagnosing where these tense areas are. So I'll do that by touch first, just to get some idea of where they're located. And if you're wondering what I'm looking for, it's particularly areas that are either sensitive and the client might react as you touch them, or when you're massaging, what you're looking for are areas that feel almost like crystals when you're massaging that area, or they could be feeling like grains of sand or knots that sometimes pop when you massage. And that's areas that are areas of tension, and that could be or bumps in the tissue or in the muscle area. often resulting from a buildup of lactic acid, and that really tenses the area up. And if you've got quite a few of those areas, and I suspect that there'll be a few around this area, if you've got quite a few, that can build up tension and make that whole area quite painful, with muscle aches and pains. And actually massaging out those areas can really make a difference and take down that tenseness and reduce overall stress levels as well. Because if you're worried about what's causing that tenseness and pain, that can bring on stress. So I'm just going to do a back stretch to start with, just so that my hands and arms get familiar with the back area, and it helps to relax everybody as well. And what I can feel already is that this whole area, particularly on the right side here, is actually quite warm to the touch, and that tells me that there are some issues in this area here. So what I'm going to do now is do a little bit more of a deeper diagnostic stretch, and as we move around, I'm going to mark some of these areas. So we've got some tenseness down here as well. Right, so I can already feel that there is some tenseness in this area here. So we'll mark that up and then note that to come back to. And then we're going to keep moving up. There's another bit of tension here. I think this is just a build-up as we get nearer to this shoulder. Be interesting to see if we have the same on the other side. Right, this whole area, you can feel it's very gritty. I'm going to go slightly inwards around the scapular area here. Right, this whole area here is popping away. It's quite a large area there to work on, and I can see that that is why you're having problems here. And then we're going to move up into actually the neck area as well. Still all that area there. Funny enough, your shoulder area here seems okay. It seems like it is this area. So it could be where you're typing, possibly when you're sat at the PC, because it's forming a line along your back, and that's a build up towards this shoulder area here. So I can understand why you've got that, and it does feel incredibly warm around here. So I'm going to try and see if that is similar on the other side. So what I'm going to do is just check on the other side. And that is absolutely fine. So I do think this is very much a right-sided tension build-up. That's a little bit here. And actually, funny enough, you've got some erythema coming up here. Actually, I'm going to mark those, because although I haven't felt anything, it could be that they're deeper in there. That's good, because it means the blood's circulating, but might be worth just picking up on that. Okay. Another one just there. But that is only a very small bit. And a little bit there on your neck as well. It's in the same area. So that is quite interesting, because it's very much on the right side with just a few points on the left side there. So really this allows me to identify that the best way of doing the massage is doing a gentle massage overall, but really focusing the deep massage in and around these areas here. Right, so I'm going to do a gentle back massage routine, but where we've got these marked areas, I'm just going to come out of the normal routine and just do a little bit more in depth. So let's just do the normal body massage routine for the back. But I'm actually finding this a really interesting way of helping to identify where those areas are that you really need to work on. Then what I'm going to do is just do some quite deep massages to that area, and the marking will hopefully come off as I'm doing it. I've got a cloth to take it off at the end. Really pushing in quite deeply into this area here where I've marked that. Spend a little bit of time on that area. That should really help to relieve that. Not forgetting that we need to work the rest of it as well. So when we do some vigorous work, then we need to do some calming moves as well. Right, so I'm just going to massage these areas here, and I can feel that popping under my thumbs. So that should really help on this side to clear that totally. And then on this side, I want to do something a little bit more just to ease that off. And that's good because we're getting some erythema there as well. Okay. Just going to massage this bit here. There we go. And then we're getting to this concentrated area where there's quite a lot of pain and tension. So we're going to really work this whole area. If I could ask you just to pop your hand up slightly. Yeah, thank you. So I just want to avoid getting into that bone area, but you can see there's almost a pattern here. It's going right along. And then what I'm going to do, although there wasn't really any sign of tension in the top of the shoulders, if I pop that back down, I am going to massage just this bit on the top of the shoulder here. And I'll do the same on the other side as well. Just locate these tense areas here. And then we'll just massage this whole area. Just going into the base of the neck here to just relieve those two areas there that we identified as well. It's really helpful to have these markings actually, because it's really got right into where you can feel these grains of sand. And they're slowly clearing, which is wonderful. Right, let's get some gentle moves down here. Now, we haven't been able to use oils because obviously we're marking those areas. But what you could do as an alternative is you could do the markings, memorise those visually, and then blend an oil that will help you. I would suggest for muscular aches and pains, something like a carrier oil would be sweet almond oil, because that's always good for muscular aches and pains, a nice calming barrier oil. And then if you wanted to add some essential oils, just like one drop of each, you would use something like eucalyptus, rosemary, ylang ylang. That's a good mixture, especially with that carrot oil. As long as you visually noted where the markings were, and you would concentrate that oil and the massage in those areas. Right, so that brings us to the end of a slightly adapted back massage based on the consultation that you've had with your client, focusing on the particular areas that we highlighted with those markings, so that they get a massage that is really individualized to their need at that particular time. And in this instance, we could see that the majority of those markings were leading from the right side at the bottom into this shoulder area, which we've given a thorough massage to, and that should really help. But I suspect that this is the result of seating poorly, so you need to look maybe at that and then take considerable breaks. Remember, you should be taking sort of 10 minutes out of every hour if you're focusing on PC usage. And I suspect that that's what's caused this, but hopefully just working that area in particular will have given enough relief to allow that area to not feel so tense and decrease stress levels overall. So one last effleurage set, and then I think we will leave the back to heal. We're going to start the massage now, but I'm actually just going to get myself ready because I need to do a little bit of deep breathing myself. So you just relax where you are for the time being, and I just need to take in a couple of deep breaths. And that helps me relax for the massage so that I can give you a good massage. Right, what we need to think about is your hair, beautiful hair that you've got here. Just going to make sure there are no major knots in there, because when I get to do a little bit on the scalp, I need to make sure that I can run my fingers through your hair. So that's helpful. So I'm just for now going to put it to one side so that I can get to your back. Can you just acknowledge that you're comfortable?
Yeah, lovely and comfortable.
Beautiful. Right. And the temperature is okay in the room and you're warm enough?
Yeah.
Okay, lovely. So what I'm going to do to start with is just take the oil that we blended earlier and actually pop that onto your back. And I'm going to warm it in my hands first, just so that we get a nice lot across your back there. We just want a tiny bit more, and hopefully you can smell that wonderful blend that we decided on earlier, the bergamot, lavender. There we go. Right, okay, I'm just going to start the massage now. So just going to make sure that I blend in that oil into your back. So the beauty about aromatherapy oils is they can be absorbed by the skin quite easily. Just think we need slightly a little bit more on the top of your shoulders and the top of your arms there. It's a little bit dry there. There we go, a little bit more on there. Right, so what I'm going to do now is what we call the diagnostic part of the massage. And this is where I identify any areas of tension. So I'm going to start with using my whole forearm just to see if I can spot any particular areas of tension. And already I can spot that there's some areas around your shoulder there. Is that where you hold your stress levels or your tension? Yeah. Okay. And then what I'll do is slowly work my way up your back, and you'll feel a slight push. And this is where I'm diagnosing any stress parts. And what happens is, as I'm doing this, sometimes your skin can show a little bit of redness. And that's where you get sort of these crystals popping. And we'll do that again. There we go. Definitely around this area. There's a little bit of popping going on. So I'm just going to do the other side of your spine here. We never massage on the spine, just either side of it. And again, lots of popping going up towards the top here. So what that tells me is when I do some what we call petrissage around and effleurage around your scapula, I'll make sure to release those popping areas. That's where you've got a build-up of toxins, which could be adding to your tension and your stress in your shoulders. Yeah, so that's the first diagnostic there. What we're going to do is move on to the second diagnostic, and this is where I'm going to press a little bit into the gaps along the side of your spine. And again, with just a little bit of pressure. Just really clearing any toxins that you've got there. We'll go down and do that on the other side as well. Oh, did you feel that one there? Yeah. There we go. It's funny how you've got more stress on your sort of left side than your right side. Maybe carrying things on your left side a little bit. On the left, yeah, that's coming up there as well. So what I'm going to do now is work around your scapular area on both sides, but I'm going to treat one side first and then the other. So what I'd like you to do is relax your arm, and then I'm going to put it slightly on the bottom of your back, and all that does is raise this scapular area here for me so that I can just drain it a little bit. And then I'm going to do what we call very small movements of petrissage over here. And that releases any tension you've got in this particular shoulder. Okay, and then just going to go round to the other side and do this side as well. Just helps to release that a little bit more because we identified that that was a little bit of a problem. Just pop your arm back in, and then what I'll do is just do what we call a little bit of figure of 8 around this area. I'll go back a little bit more, do that from the other side as well. I'm just going to do some deep circling motions around your scapula. So again, we've identified this as an area of stress, so we'll just massage those areas out. It's really loosening up nicely now. So popping is lessening. And then what we're going to do is I'm going to put some more oils on my hand because we're going to go up towards the scalp a little bit. Just going to get oils on your hair a little bit, but you really will benefit from that. So at the base of the skull here, we have some wonderful pressure points which we can release very, very gently. You don't need much pressure at all. Can you feel that? Very relaxing.
Yeah.
You're almost asleep.
I'm so sleepy.
That's fine. I'll keep going. Then we go up into the scalp, up into through your hair. It's like a press and release move. I've not done this for a very long time, but it feels lovely. There we go. Reminds me of the good old Indian head massage, which I'm sure we'll move on to at some point. I'm just going to do a bit of shampooing, mimicking when you're shampooing, but it's very relaxing when you're doing it with oils and massaging. Really helps to relax the tension you've got at the back of your neck. you've got quite a lot of chakra points in your head here, so you have to be very careful you don't press too hard on them. So just a nice gentle massage will do. Your gorgeous hair. Okay. Just need a little bit more along the neck here. And then we're going to do a reverse effleurage down the back. Just going to drain out to your pelvis there. A little bit of popping going on at the bottom there actually. Often if you're sat at a desk you do get lots of toxin build up around the pelvic areas here. Just get rid of that for you. Right, I'm just going to do a squeeze and release method here along this nice and slowly. Do this a few times. Okay. That's squeeze and release. I'm just going to do a transverse effleurage just to relax the back overall. It's got some fanning to do. This is called fanning, I think, because it looks like an open fan. Slightly more aggressive move there than normal with aromatherapy. That's probably one of the few in there. That's because aromatherapy should be very gentle rather than like a body massage, which has a few more precise movements in there. Right, I'm going to do what we call a back stretch. Just going towards the end of the massage. Do some stroking effleurage. We're getting used to all these movements again. Must admit, I love doing this. And then what I'm going to do is just rest my hands on your back. And if you could do some gentle breathing exercises with me.
Okay.
Just 3 deep breaths in through your nose and out through your mouth. That's lovely. And I'm just going to pop this blanket so that you stay warm. And then you can stay on the couch for as long as you want while I go and get you some water. And then I'll go through aftercare with you.
Okay, thank you.